Hey there. If you're caring for a child who has high muscle tone, you already know that just understanding what's going on is the biggest first step. So in this explainer, we're going to demystify hypertonia. We're going to break it all down using insights from pediatric physiotherapy experts to give you clarity and a whole lot of confidence. Let's dive in. So let's just start with our really fundamental question, right? What is actually happening when a child's muscles just can't seem to let go? This simple question, it gets right to the very heart of a condition that really shapes movement, comfort, and the day-to-day for so many kids. All right, so that leads us right here. What exactly is hypertonia? Let's think of it as the problem of muscles that basically get stuck. Okay, so what are we really talking about? Hypertonia, which you might also hear called spasticity, is basically a condition where a child's muscles are just overly tight. You can think of it like a light switch that's gotten stuck in the on position. That constant tension, it makes smooth, coordinated movement really, really difficult. And yeah, it can definitely be uncomfortable for the child. Now, this is super important to remember. Hypertonia usually isn't a diagnosis all on its own. It's almost always a symptom of some other underlying neurological condition. We're talking about things like cerebral palsy or brain injuries or certain genetic disorders. And that's exactly why managing the hypertonia is such a huge part of a child's overall care plan. Okay, we've got the definition, but what does this actually mean for a child? What's the real so what in their everyday life? And this is where it gets real, right? As a caregiver, you see this stuff firsthand. You might notice those stiff, rigid muscles, or that scissoring of the legs. That's not just a sign. It's what can make something as simple as changing a diaper or putting on pants a real challenge. You might also see unusual postures, like a hand that's always in a tight fist, or an arm that stays bent, which can get in the way of playing. All this constant tension can limit how far their joints can move. It can delay motor milestones, and it causes a ton of fatigue, even from really simple activities. So, when you're facing all these challenges, where do you even begin? Well, this brings us to the absolutely crucial role of physiotherapy. This is the path to better, more comfortable movement. This slide is so important because it's all about setting realistic expectations. Physiotherapy is incredibly powerful, but it's not a magic wand. What it does do, and does really well, is manage that stiffness, improve mobility and function, and prevent long-term issues like joints getting stuck. But what it doesn't do is eliminate the condition itself or cure that underlying neurological cause. The key takeaway here is that therapy is all about management and improving quality of life. Okay, so what does this management actually look like in practice? Let's kind of pull back the curtain and take a peek inside the physiotherapy process. It all kicks off with a really thorough assessment. A therapist is going to start by evaluating your child's specific muscle tone and their posture. Then they'll watch their functional skills, how they roll over or sit up or try to stand. And honestly, maybe the most important step, they're going to sit down and talk about goals with you, the parents. This makes sure that the therapy plan is perfectly tailored to your child and your family's needs. So, based on that deep dive, therapists use a bunch of different techniques, and they're all gentle and really effective. For example, gentle stretching is huge for keeping joints mobile. Weight-bearing activities are great for helping with muscle control. And specific positioning strategies can help reduce those unusual postures we talked about. It's all about finding the exact right tools for your specific kid. Now, therapy sessions are obviously essential, but the real work, the real progress, it doesn't stop when you walk out of the clinic door. Management is a 24/7 thing, and that really shines a light on the family's vital role in all this. And this is where you, as a caregiver, become a true therapy partner. You can take all the benefits from those sessions and weave them into your everyday life. We're talking about things like simple daily stretching routines, making sure your child is in a good position when they're playing or eating, and learning safe ways to carry them. It's all about making this stuff part of your normal, fun daily routine. Okay, before we finish up, I want to tackle a few common questions that caregivers always seem to have. And the first one is probably the biggest one for any parent. Is this therapy going to be painful for my child? And the answer, thankfully, is a big, clear no. A good physiotherapist will always make sure that every single technique is gentle and perfectly adapted to your child's comfort and what they can tolerate. The goal is always, always progress without pain. Okay, next up, timing. When's the right time to start physiotherapy? Can you start too early? What's the deal? The expert advice on this is crystal clear. The sooner, the better. Early intervention is what everyone recommends to support a child's development right from the get-go. Taking that proactive approach is so crucial for preventing other issues, like stiff joints, from cropping up down the road. And finally, let's talk about your role as the parent. How important is it really? Do you have to be actively involved for all of this to work? The answer is a resounding 100% yes. Your involvement isn't just helpful, it's essential. You are the key. You provide that consistent care at home that really builds the foundation for long-term success. And all of this really leads us to our final takeaway, which is summed up perfectly right here. Success isn't just about what happens in a therapy session, it's about a true collaboration, a partnership between the therapist, you the caregiver, and the child's entire environment. It's that teamwork that truly empowers a child and helps them achieve their absolute best. So as you go about your day, just think about that. What's one small thing you can do today to build on that collaboration?